Midwives provide care for mothers-to-be, and they also help deliver babies. Most are not regulated in the state of Nevada, and legislation is being considered to change that. Earlier tonight at 6, the I-Team first brought us a story about a mother who was suing a midwife and members of her team. She had been pregnant with twins, but lost her firstborn during a home birth. Both the mother and the defendant sat down with the I-Team, sharing very different versions of the same events. Tonight, the I-Team's Vanessa Murphy has the different viewpoints on this hot-button issue and what changes may happen in our state.
You need a license to serve drinks and cut hair in Nevada, but not to care for moms-to-be and deliver their babies in a home.
There's still not a credential pathway for them to basically to show the consumer out there who might be wanting to do it in home delivery that there is a difference between levels of midwives.
Republican State Senator Scott Hammond is introducing Senate Bill 271 to license some midwives. There's also a similar bill being considered in the Assembly. Opponents say it would take away a mother's right to choose. Some spoke out in this YouTube video by the group Nevada Friends of Midwives.
You're taking my right to choose who I have at my birth away from me.
So I feel safer at home choosing who can attend my births, who can care for me and my babies.
While some states issue and require licensing or certification, Nevada does not. Different national and international organizations provide certification. Here's a look at the different kinds of midwives. Traditional midwives may not be certified or licensed. Certified nurse midwives are registered nurses who are also educated in graduate-level midwifery programs. They have medical training. Some work with physician groups and have hospital privileges. The State Board of Nursing reports there are 64 certified nurse midwives in Nevada. A certified professional midwife has a certificate through an organization like the North American Registry of Midwives. Executive Director Ida Dara says that's earned by passing a test and working under the supervision of an experienced midwife for prenatal visits, newborn exams, and at least 55 births.
What would you say to critics who say they're essentially providing medical care without medical training?
I would say they're providing midwifery care with midwifery training.
100 deliveries was the number of deliveries I did my first month of my 4 years of residency. First month.
Dr. Stacy McHale is an OBGYN in Las Vegas and the president-elect of the Clark County Medical Society. She says she supports a collaboration between a midwife and physician from the start.
The differences in the levels of training are very noticeable. And those levels of training and the need to have expertise and the need to have someone to provide backup if there is an emergency situation is crucial for the health of our mothers in Nevada. I have seen many of the complications that can happen with deliveries, even those that we anticipate are going to be normal. And having home birth midwives makes me very anxious.
What about those rare emergencies? Is it worth taking a chance?
Nobody looks at their own pregnancy as taking a chance. I mean, that's why you're getting regular prenatal care and assessment so that you have a clue if anything is potentially problematic. But could something really surprising come up? It can come up, and that's why you need to address what you will do if you have problems like that.
Right now, Nevada has no oversight of any midwives. Through Senate Bill 271, Senator Hammond is proposing the creation of a board of certified professional midwives, licensing for CPMs, and permits for apprentices. With oversight, there would be regulations and disciplinary action would be possible. While Assembly Bill 387 is similar, it states if an unlicensed person practices midwifery, they must obtain a statement from a client acknowledging they know the person is not regulated by the state. If the midwife doesn't get that statement, they could be charged with a misdemeanor crime. It also lists guidelines for when a CPM must arrange for consultation with a health care provider.
What midwifery care is here in Nevada now is unregulated, and that's why it's unsafe.
I hope it allows consumers to have freedom of choice, as well as to have midwives have a good path to getting licensed that is not too onerous for them to meet.
The legislation is currently being considered. No hearings have been scheduled yet. Vanessa Murphy, 8 News Now.
The I-Team checked in with local hospitals to find out whether they have relationships with midwives. You can find that information at 8newsnow.com, as well as the I-Team's report on midwifery, which aired at 6 o'clock.